Hello, my name is Dr. Kevin Kaplan. I'm the head team physician for the Jacksonville Jaguars and an orthopedic sports medicine specialist at the Jacksonville Orthopedic Institute. I'm here to discuss meniscus tears in the knee. There are two different types of cartilage in the knee. One is called articular cartilage, which is the cartilage you find on the end of any bone in your body, and the second is called the meniscus cartilage. And this is the cushion between the bones, and it helps prevent the bones from rubbing on each other and helps prevent arthritis in your knee. And there are a lot of different reasons why you can get a meniscus tear. One is simply from a wear and tear phenomenon. We all walk on our legs, we bend, we twist, we do sports, and very much like a tread on your car tire, it can wear down over time. And when wearing down, you can get little cracks, you can get small fragments of the meniscus to break off, and that can certainly cause discomfort in the knee. The other reason people get meniscus tears is from the activities they do, whether it's basketball or running or CrossFit, and that can also wear down and cause a tear in the cartilage in your knee. Conservative management for a meniscus tear includes things like anti-inflammatory medications to decrease the inflammation, ice, rest, and even physical therapy exercises to strengthen the muscles around the joint. Now, if you have continued pain from a meniscus tear, then meeting with a physical therapist and or an orthopedic surgeon can better evaluate the situation, and we may order an MRI of the knee. An MRI is a way for us to quantify how bad the meniscus tear by looking at the soft tissues. Occasionally, after a meniscus tear, you can receive a corticosteroid injection, which will help to decrease the inflammation caused by a meniscus tear as well. If a meniscus tear causes mechanical symptoms like locking, catching, popping, or instability where your knee feels like it's going to give out, then it's recommended that you have a knee arthroscopy. Knee arthroscopy is a minimally invasive surgery through very small incisions where we use a camera to evaluate meniscus and then determine whether or not the meniscus can be fixed with a number of stitches, or if we need to just trim the part of the meniscus that's torn. It's important for us to save as much meniscus as possible because obviously that's still the shock absorber and helps to prevent further arthritis in the knee. Typical recovery from a meniscus surgery, if it's just trimmed or a piece of it needs to be removed, is about 4 to 6 weeks. If you stitch a meniscus, then you go through a period of non-weight bearing and limited range of motion to allow that cartilage to heal, and that takes several months to get back to full activity. If you have a meniscus tear or think you have a meniscus tear with locking, catching, popping, and swelling in the knee, call JY 2000 and we'll be happy to help.